London, global health experts and government officials joined in criticism Saturday over President Trump's plans to cut ties with the World Health Organization and funnel U.S. money elsewhere.
In the remarks made in the Rose Garden on Friday, Trump blamed China for the COVID-19 pandemic and accused Beijing of effectively controlling the WHO and pressuring it to mislead the world.
The United States is the single biggest financial contributor to the UN agency, and its exit will hit its budget even as it struggles with a global pandemic that has resulted in more than 364,000 deaths.
Trump said that the annual $400 million that the U.S. contributes to the organization will be redirected to other worldwide and deserving urgent global public health needs, without giving specifics.
Live updates, the latest on the pandemic.
Jens Spahn, Germany's health minister, tweeted in English on Saturday that Trump's decision to sever ties with the organization was a disappointing backlash for international health.
Spahn added that the WHO needs reform if it is to make any difference for the future. Germany will take over the rotating EU presidency in July, and the minister said finding a way for the European Union to take a leading role and engage more financially with the UN agency would be prioritized.
South Africa's health minister, Zweli Mkhize, called Trump's move unfortunate.
Certainly, when faced with a serious pandemic, you want all nations in the world to be particularly focused on one common enemy, he told reporters, according to the Associated Press.
A spokesman for the British government said the WHO had an important role to play in leading the international health response to the pandemic. We have no plans to withdraw our funding, the statement said.
The European Union urged Trump to reconsider.
In a joint statement, EU Commission President Ursula von der Leyen and Foreign Affairs Chief Josep Borrell said that, as the world continues to fight the COVID-19 pandemic, the main task for everyone is to save lives and contain and mitigate this pandemic.
Now is the time for enhanced cooperation and common solutions, the statement added. Actions that weaken international results must be avoided. We urge the U.S. to reconsider its announced decision.
A number of scientists and global health experts also stepped forward to voice their support for the organization.
In Australia, Peter Doherty, the founder of the Doherty Institute, whose modeling has played a role in the government's response to the crisis, tweeted that the WHO is central to the global fight against COVID-19. He added that the leadership has seemed overcautious in some of its statements, but added that much of the real, essential work of the WHO goes on at lower, professional levels.
Gail Carson, Director of Network Development at the International Severe Acute Respiratory and Emerging Infection Consortium, warned that a pandemic was not the time to make health political.
Richard Horton, the editor of the Britain-based Lancet Medical Journal, which has not shied away in its criticism of Trump's handling of the crisis, wrote, "We give our 100% support to the World Health Organization at this time of crisis.
The U.S. government has gone rogue at a time of humanitarian emergency," he added.
What you need to know about the World Health Organization.
Researchers, COVID-19 could cause long-term ailments for some patients.
Pandemic's U.S. death toll likely passed 100,000 weeks ago.